is Penny Wright, and I'd like to welcome all of you to this Coffee and Conversation with hosted by David Alpern. And David, as many of you know, was a longtime radio host and editor for Newsweek. He's been a really great friend to our library, and we're so grateful to David for running these programs. And also to Joe Shaw, who is our special guest today, who is a longtime executive editor of the Express News Group. Is that correct, Joe?
That's it.
And
I have to get used to it too, Penny, but yes, it's Express News Group.
And as anyone who knows about newspapers knows that Tuesday or Wednesday is a very busy day in the newspaper business. So we'll go ahead and get started. I'll turn it over to you, David. Thank you.
Thank you, Penny. Good morning from Sag Harbor. Glad to see you all out there in Zoomhampton for what the Rogers Memorial Library calls Coffee and Conversations with issues in the news. And I hope we really make it a conversation. With me, as Penny said, is Joe Shaw, executive editor of the Express News Group, to help us all consider how these first months of the coronavirus pandemic have affected us, our area, and the world beyond. There's no doubt that the health crisis has become tangled with political partisanship and disagreement over even some basic facts of the matter: masks, social distancing, treatments, vaccines. But let's all try our best to be civil and tolerant of differing views. Of course, we've all heard the U.S. statistics nationwide. More than 6 million cases, approaching 200,000 deaths, or 563 per million population. Fewer than Peru at nearly 1,000, Belgium, the United Kingdom, Spain, and Italy, Brazil, and Sweden, but more than Mexico, Panama, France, and Bolivia, assuming all counts are more or less accurate. Some experts are expecting more than 400,000 U.S. deaths by year's end as cold and flu season combine, with more returns to on-site work and schooling. While the stock market has soared, big business by comparison has been recovering slowly, and much of small business fears for its survival as many workers and patrons remain locked down by government guidance or their own safety concerns. For a local view, let's turn to Joe Shaw, who spoke with a wide range of experts and officials about why New York State has been so successful in controlling the virus, and our area in particular. Joe?
Yeah, David, that was one of those stories that was driven by my own curiosity. I have been watching and expecting a spike in New York because that's been sort of the standard all over the nation, is that even states that have gained on this virus from time to time are seeing occasional spikes. And it just seemed to make sense that, especially with the start of the summer season and the influx of people here, that we thought it might be likely that we'd see a spike in cases. It wouldn't necessarily mean failure. It's just the way this virus works. When you get groups of people together in a place, it's going to spread. But we haven't seen that, and I was sort of intrigued to watch New York's numbers. And if you saw the charts, that New York, of course, was the earliest with California to see the high numbers. But after we passed the peak, it has been a steady downward trend, and it's stayed low. I think the governor said yesterday that the number of new cases, they're testing every day, and the number of new cases is less than 1%. It's been that way for about 30 days, I believe, which is pretty remarkable when you think about it. And the state has done a lot of testing, but just in any of the numbers that you look at, number of new cases, the number of hospitalizations, certainly the number of people in ICU being treated for the virus, they're all down, and they've trended down, and they've stayed down, and we haven't seen any kind of a peak. And we talked to a bunch of people to try and get their thoughts on why, and some of them are epidemiologists locally, the folks who are in charge of infection control at the hospitals. And the answer is kind of simple. It's that New York really did adopt the proper practices early on. And I think it's although everybody notices the exceptions, I think widely people have been wearing masks. People have been social distancing. People have been washing their hands frequently and being careful. Those things work. And New York is kind of a clear example to demonstrate that. And I'm actually really kind of gobsmacked that we haven't had a spike locally. I just assumed it would happen this summer, just because of the necessity of having people coming out here. And we had editorialized before summer started that keeping beaches open and taking necessary precautions, but keeping them open was a sensible thing to do, because being outside and at the beach seemed, according to all the experts, to be a safer thing. And that's proven to be true. I think it's fair to say that even with some of the local incidents of people who have been seen violating social distancing rules in clubs and on the beach and on the streets, you've certainly seen examples of that. We haven't seen a spread here, and I think that's testimony to the fact that the experts know what they're talking about, and we should listen to them.
Two questions, Joe. To what degree would you attribute the success and the sane behavior, obedience even, to the way Governor Cuomo really took the spotlight at a point where the national government was still sort of denying the evidence? I mean, it faded after a time, but it seemed to me, and personally, that became must-see TV. There was a kind of a truth in what he was saying, and to what degree do you think his encouragement, his leadership, if you want to say it, affected the way the state behaved?
That's a great point, David, and I really believe, I agree with you. I think that that means more than people give it credit for. I think having the leader of the state make such a strong statement early on and have a consistent message was invaluable, and I think it did work. I think, it's like I said, I know that people focus on the exceptions to the rule, but I think that the use of masks, every time I go to Stop and Shop, or anytime I go to Riverhead to do some shopping, I don't see a single person without a mask on, and it's pretty remarkable. And I remember a statistic that I read from a reputable source fairly early in this thing, and that was that if 80% of the population follows the masking rules, that's the tipping point. That if you can get 80% to follow the rules, then the other 20% who won't, or are making a political statement or whatever, they can do that. It won't change it. If you get 80% of the public to follow the rules, it kills the virus off eventually. And I think New York hit that mark, and I think you're right. It was largely because of strong leadership at the state level, but even at the local level as well. I think there was consistent messaging here from start to finish.
The second question is, we talked about the problem. What has been the impact on small business in our area? I mean, we see, for all of the talk about the Manhattanites coming in, I can say that now because we've been living here full-time for almost 10 years. So that makes me a full-time weekend person. What has been the...
In another 10 to 20 years, you'll be a local.
That's because all the locals... Right. But what has been the impact on, I mean, we can see all of the real estate going on. I mean, people feeling that they can't afford their mortgages, that there'll never be a better time to sell their property. Lots of money coming in from people who want to have a place out here. Shops, restaurants, what's your overall feeling about the impact on the business community, large and small?
Yeah, that's the big question. And I think you can split it into a couple of different categories. I think when you talk about retail, I think they've probably been hit the hardest. And I think service industries seem to have done okay through this. And I think they have figured out workarounds and ways to continue providing a lot of the same services and the demand is so strong that I think they have been able to do that. Restaurants is a fascinating topic, and I think one that we're going to dive into in the next week or two at some point to talk about it, because as with retailers, I think it's about pivoting. The successful restaurants pivoted, and they were able to make the change to becoming takeout establishments primarily for a very long time through the early months of this. And the ones who are lucky enough to have properties that allow for outdoor dining, I'm going to venture a guess, and this is purely an opinion. I don't have anything to back this up, but I think some restaurants out here have actually had an excellent summer because they have been able to accommodate the challenges that the restaurants are facing. They've been able to do outdoor dining well. They've been able to do takeout well. I think other restaurants that haven't been as fortunate, weren't as aggressive in making that pivot, really struggled. And I think we're going to lose a lot of restaurants because of that. So, we were talking before we started recording about how a lot of businesses, our own for sure, have learned to innovate through this, and you have to adapt some new strategies and be able to do that quickly, and you have to be able to do it well. And I'm afraid that a lot of businesses out here, and I mean, there are some businesses that have no choice. I mean, along the way, we've talked to different businesses. I mean, I did a story a couple of months ago about West Hampton Beach, and the village in West Hampton Beach has been through a rough year in 2019 because they did their Main Street project, and that ended up affecting a lot of the local businesses because it made it hard for customers to get to them. Then as soon as that project wrapped up and it was like, hey, okay, now we're getting ready to get rolling, the virus hit. And a lot of those businesses ended up not being able to reopen or to reopen in small ways. But there were businesses that started doing online where they didn't before. There's the chop shop over there, the butchers began an outdoor market type of a setup that was really innovative, and they had a line on a daily basis. It's been a test to see how businesses can adapt to the unexpected. And boy, this was, we all knew it was coming at some point, I think, and the experts have been warning that for years and years and years, but it happened sort of so quickly, and it caught a lot of businesses off guard, I think, and I'm afraid some of them won't make it through. And there's a ripple effect too. We're a newspaper. We count on advertising revenue. It had an effect on our business, and we had to pivot and we had to adapt. And we're going to survive it, and I'm happy to say. But it's not a given for a lot of businesses. It's a rough time. There's no question.
Let me ask this: what about some of the other indices? Crime, for instance. I know people in New York City who are blaming the mayor for all the shootings and the crime, and you have to say, wait a second, look around you. This is a hugely difficult time for people, especially at the very low end of the income scale. What's been the situation here? Have you seen anything corresponding in any scale to the crime problem that New York has had?
I don't think so. I think it's interesting. It's another phenomenon that books will be written about, I think, probably about how in New York City especially we've seen this uptick in violence. And you have to think it has something to do with the pandemic, but we certainly haven't seen that here. We haven't seen any kind of uptick in violence, and I don't know, from keeping an eye on police logs and things, I haven't seen an enormous rise in property crimes. I know the one thing that's been pretty well publicized is the vehicle thefts. It's intriguing to me that there's been a lot of vehicle thefts this year. I don't know that has anything to do with the pandemic. That's been a trend out here, and it's actually really interesting because I think the local police will tell you that there are organized groups of criminals who are coming out and they're taking the low-hanging fruit, which is people who leave their keys in their car, in their luxury cars, and they're having no trouble finding those. They're all over the place, and we just had a new spate of those kinds of thefts last week. I don't think that has anything to do with the pandemic. So I don't think there's necessarily been a big uptick in.
Well, but let me stop you. I mean, there are more people with those supercars out here, more full time than they were before. And as somebody famous once said, the banks are where the money are. Those cars are the most expensive stealable item, which can be removed, from a location. So it makes some sense that people under pressure and with more tempting fruit hanging on the curbside. So I think there's some connection.
I think that's fair. And but I will say that the organized gangs of car thieves, I think, has been operating out here in the summer for the last couple of years. It's not a new phenomenon. And what's amazing to me is, and I've had conversations with Chief Steve Skrinecki from Southampton Town, and the frustration is palpable, where he is saying, what do I have to do to tell people not to leave keys in their car? It's the simplest thing in the world, and it would stop the vast majority of these thefts, because these car thieves are just going property to property in the high-end neighborhoods and looking for the cars that they can steal in the easiest way possible. So,
especially since so many cars don't really have car keys anymore. They have these fobs that people keep in their pockets, and they should just leave them, in their pockets. But that's an interesting question. All right, I'd like to open this up now, and I would encourage people to go to gallery view so we can all see people who are raising their hands because they're agreeing with something or they want to say something. But let's try to make this a conversation. And my first question is how far back we are all to normal. How far have we gone? To start, I'd like to see, by a show of hands, who's gone back to work outside the home. Well, okay, Johanna. And how do you feel about working outside your home at this point?
Joanna, we can hear you.
I'm used to it. It was really hard at first, but it's nice to be able to get out of the house and do work at work and do home at home. So it's nice.
That is the big trade-off, isn't it, Joanne? That I'm working from home, and I'm continuing to work from home for the foreseeable future, just out of an extra dose of cautiousness. But that's the trade-off, is it really removes that line of demarcation between work and home. And I've actually found a nice balance. I have my office that I commute. I always say I have my commute, which is from the kitchen to here in the morning, and I'm here pretty much for the day. And when I leave the office, I don't come back in. I try and still set up some artificial line of demarcation between home and work, but that's the big trade-off for those of us who are doing it.
Are you finding, as the editor of a big news organization, presumably a lot of people are working from home, doing their jobs, writing at home. Are you finding a difference in the quality of people not going around, as Murray Kempton used to say, except virtually, by Zoom, by email, by telephone call? Are they getting more richer stuff than they would if they had to be driving here and there to do their personal interviews?
It's really an interesting question, and again, this has been this isn't a new question. It's one that we've had for years. We have snow days. What do you do on snow days when your reporters live far away from the office? Is it fair to ask them to come in to make that treacherous drive sometimes to come into the office to work? I think what we're seeing is some of it is detrimental. Our reporters are still out and about. They're just doing it with home as a base rather than the office. And I've always said, when I look around the newsroom and I have my staff in the newsroom, I always say it's the one building in town where there is no news. Nothing is happening in our newsroom. It's the most boring place on earth. So the fact that our reporters are out, either at home or working from home and getting out, I think there's actually sort of a small benefit to that. And what I find interesting is Zoom has created a whole new way of reporting that we're really taking advantage of in a big way. With things like, as I said, we did our Southampton Village debate via Zoom. We were able to release the video of that to a public, and this goes back to what you were saying about the library programs. I think it reached a much wider audience that way. We did endorsement interviews in East Hampton Village, and for the first time ever, we recorded those. Those normally take place behind closed doors, and we've talked for years about recording and releasing those to the public as a matter of transparency. We did it this year just out of necessity. I think that's a good thing for readers who get a little more information than they would have gotten otherwise. And so we talked about the Q&A that I did, David. Those things are so much easier to do via Zoom, and you can record the video and get a transcription of that. It's actually allowed us to do more at a time when our resources are down. So it's a mixed bag. I think it's a challenge in some ways, but it's actually shown that there were benefits to it that we could have been taking advantage all along and didn't.
We talked about restaurants as businesses, but I'd be interested, I mean, even in our little small group, if you would turn on your video, who has actually been eating in a restaurant, at a restaurant, or taking away food from a restaurant? Okay, Joe?
We do it all the time. We get takeout a lot. We try and support the restaurants. We've been getting takeout quite a bit, but we've also ventured out, and we had a lovely dinner at 1770 House in Hampton, which has the outdoor seating, and they've really done it well. It's even more of an event right now when you go out to eat. But we've done a little bit of that here and there. I think we're starting to loosen up a little, and I suspect that's probably true of all of us, that we're starting to get together with friends a little bit more and do some of those kinds of things. We're all very careful, but we're trying to get back to something like normal.
One recent survey I saw says 60% of Americans are eating more plant-based food as a result of the pandemic, which hit meat and poultry operations hard. I wonder if anybody, I mean, I hadn't really thought about it, but does that apply to the people here?
No.
You're avoiding meat or chicken or,
No.
Well, I mean, there was a point where the prices were going up because of the problems in the operations, but I thought that was interesting to ask about. And what about shopping? Just the basics, more than that, mostly all online. Come on, let's hear for some other people. How are you doing your shopping these days?
I've been mostly going to the supermarket, or I live near North Sea Farms. So early on, I lived out of there. I could get a chicken, I could get vegetables, and I didn't have to go into a big store. Little bit online for things that you couldn't get anywhere else, like hand sanitizer early on. But I haven't shopped in a store for like clothes or anything.
What about back to outdoor sports, exercise? I know Penny walked with or without masks. I mean, are people, I know I'm actually playing bad tennis 5 mornings a week. We wear masks from the cars to the court, and then we take them off because nobody gets very close on the court, and then put them on to the walk back. Not that it's really necessary, but as Joe said, and because of the governor, you don't want to seem to be not doing the right thing, even if it's just the walk from the court to your car. It seems a reasonable thing to do. So who else is at least enjoying the outdoors to that extent?
I've been doing outdoor
ahead.
yoga at.
Let's let Lisa talk. Go ahead, Lisa.
I was gonna say I've been really enjoying the outdoor yoga in the square in Amagansett Square, 8 o'clock every day. They have it now. I guess as of like probably midsummer they started doing it every day, and you wear the mask, but once you get on your mat, you can take off the mask, and everybody's spread around, with proper distance. And you're out in nature, you're looking up at the trees in the sky, and I'm not usually a morning person, but I've been getting up and getting out to do that regularly, as well as walks on the beach and stuff like that. Just, I'm taking a lot of comfort in nature right now, so it's really important to my headspace to do those things.
There's a yoga group in Sag Harbor at Massachusetts Park where we're playing tennis up on the courts. We can see people with their mats and hear their exercises, and it's encouraging.
I'll tell you one industry that's benefiting is golf. Golf courses. I've been golfing on a weekly basis with my usual foursome, and we've adopted some social distancing measures. For instance, there's no high fives anymore. It's tapping putters. That's what we do. We reach out and tap putters for a high five. But finding a tee time at any of the public golf courses right now is a challenge. You literally have to start the week before you're ready. We have one of our foursome who is tasked with at 9 a.m. when the reservations go up for the week later, for getting us a decent tee time. It's not easy right now, and I'll tell you, the golf industry was in serious decline before this, so the public courses seem to be doing pretty well this year.
Yeah, I have to be up at my keyboard by 8 a.m. to make a reservation for a court 3 days later. And you can see people overbooking, and people have to switch around because.
Uh-oh. Okay, there's a message while we're waiting here. There's a message from Jan. Could someone address how the poorer members of our community are doing? Is there a concern about evictions, food insecurity? Do our villages have plans or resources to contend with increased need? While we're waiting for David, could you address that?
Yeah, I mean, the food pantries in particular have really been overtaxed, and what's wonderful about it is I think a lot of people have stepped up and really made an effort to make sure the food pantries in particular are well stocked. Because, I mean, look, there's two things happening. I think you have people going to the food pantry who are not their typical clientele. I think there are a lot of people who are food insecure right now and relying on the food pantry in a way that they never did before. But then you also have a lot of families who are working families that haven't been able to work, and they may have been relying on the food pantry for survival to begin with, but it's crucial for them now. So one of the real heartwarming things has been how people have stepped up, and I think this region has done a great job of thinking about the least fortunate. And a couple of the local private golf clubs, for instance, have had drives and have made six-figure donations to the local food pantries, and a lot of the fundraising has been good. But I've been concerned because I think with the end of the $600 bonus unemployment that was coming from the federal government, I feel like we're going to start to feel the impact of that on our economy in general very soon, and I think it's starting now, and I think locally, I just think that was a lifeline, and I think it's really worrisome that we haven't seen a second package of benefits for people who really count on that. I mean, this is not, it's not a bonus. It's they need it to survive, and the evictions is a great point too. I mean, I think we're reaching the time now where that's going to start to get to be a real concern. We don't have much affordable housing here to begin with, And I think there are probably some landlords that would take advantage of an opportunity to clear house, and this could be that. So I mean, it's something we'll keep an eye on. I think we haven't heard about widespread issues so far, but it definitely is a concern, no question. David, you're muted.
Muted.
This is a Zoom thing we have to deal with all the time.
Yeah, no, I got disconnected and then didn't reconnect with the audio. In our first discussion of the pandemic, I raised it as an issue that, in a way, this is preparing us for larger changes. Artificial intelligence, automation is going to put a lot of people out of work, and the notion that an economy can get along without people who have enough money to buy things, in general, is very concerning. And so, I mean, despite the politics and the fight over the $600, I think a lot of people who never felt insecure before are seeing both the need for universal medical care and the need for some sort of universal income if the cycle of the economy is going to be completed, if there's purchasing power to buy the products and the services. I don't know how that's going to work out. Clearly, there's a lot of opposition now. It's become very political and involved with the personality of politics. But certainly, people who never thought that they would need a food bank or never felt as insecure before, I think begin to see the importance of government and the importance of some sort of support system, as especially artificial intelligence. We're already seeing automation replacing workers at the assembly line. We're going to start seeing white collar people whose great intelligence is suddenly superseded by the creations of smarter but very fewer people who are creating this stuff. I mean, I have to do something on artificial intelligence for the Sag Harbor Library, and so I've got stories about artificial intelligence flown fighter planes beating human pilots in simulations. So everybody is at risk. I mean, they can write newspaper stories.
Yeah, I'll tell you the one of the great fallacies to come out of this, and I think it's kind of a cruel fallacy, is this idea that the extra $600, that people were not going back to work because they were being paid more not to work. I can speak from experience in my newsroom, which was hit hard by this crisis, and we were forced to furlough a lot of really, really talented people that we haven't been able to bring back. And I will say that some of those people were making more money on unemployment with that extra $600 than they were making had they been working. There isn't a single one of those people who wouldn't have come back to work immediately given the opportunity to do that. And I don't think I think it's a cruel thing to suggest that American workers would rather stay home and collect unemployment than work. I don't think that's true. I just think that's a terrible way to look at the constituency that's out there. I think people want to work, and it puts it. The thing about the extra $600 that everybody seems to forget is it's what kept our economy floating. Having it not only saved people from complete fiscal crisis in their own lives, it kept people spending money during a time when our economy could have absolutely bottomed out. And that's what government spending is supposed to do. And it did. And to the government's credit, that first package was hefty and it was approved quick. And I think it did exactly what it was supposed to do. I'm kind of flabbergasted that we're struggling to get a second round of it, because I can tell you right now, it's aid that I think everybody could really use and would really be beneficial to a lot of businesses right now too.
Well, of course, the joke would be anything to get out of the house with the wife and the kids. But the other side of that coin is surveys showing increases in mental health problems, suicides, divorces. And we had talked about that when we first, looked ahead to the pandemic, and there were mixed opinions as to whether lockdowns would increase the cohesion of couples because they're relying on each other so much, or would end in marriages ending. And from what I saw, a week ago when I was looking through this stuff, is that there has been an increase in divorces. So I'm wondering again, not to ask anybody personally, but I'm interested to know who has seen evidence of the emotional, psychological toll of this in terms of depression, hospitalization, suicides, divorces. Is that something that you folks are seeing among your friends, families, neighbors?
I mean, it's stress.
Well,
There's no question. I think you see low level. I think you see it having an impact on a lot of people, at least on a low level. I think everybody's sort of walking around with a little low level depression, trying to deal with this. It's very different times. And I think stress finds those weak spots and goes after them. And I think we're all sort of there, but yeah, I'm curious if anybody else is seeing real crisis from people. I know that the heightened the without being partisan, just the stress levels related to the national politics right now, in the mix with the pandemic, I think is really. I think it plays off of each other and just ramps up the stress levels exponentially on people.
I think we saw, there was even talk about it at the US Open when Djokovic was thrown out. Not that he hasn't been emotional on the court before, but to have the top player in the world be so uncontrolled and to hit a ball to injure a linesman. People were saying we're all under stress, even somebody as top rated as he. But since you mentioned politics, and we're reaching towards the end, there were just a couple of things that are politics related that I'd like to ask about. The first one has to do with the vaccine. Do you believe what you're hearing about the imminence of a vaccine? Who do you believe about it? And I guess personally, would you take a vaccine as soon as it was available, or wait how long to see effective or side effects? For a month, for 2 months, for 6 months, for a year?
We're going to march right into this minefield, aren't we? Okay. Personally, now I saw the report last night from the New York Times that AstraZeneca had to stop a trial of the vaccine because of a bad reaction. I am deeply concerned that the vaccine and the speed towards a vaccine has become politicized, and it very clearly is about a deadline of election day. And that makes me personally, and I have one of the reasons I'm not back to work, one of the reasons I've been extra careful is I do have comorbidities, and that puts me at risk, unlike some people my age, and I got to worry about those things. I used to say I'll be the first one in line for a vaccine. I will not be the first one in line for a vaccine under these circumstances. I think that we have to remember there's a process for things like vaccines, and you test them for a reason. And while I want a vaccine as quickly as we can possibly get it, and I think we're on track to do that as quickly as we can possibly get it, is probably sometime in 2021 early. And I think we can feel fairly confident that you can do the proper amount of testing and vetting to have a good, effective, safe vaccine by then. I think talking about a vaccine by October, I don't think there's any way to get there without cutting corners in really risky, dangerous ways. And quite frankly, I think the concern is that the push for a vaccine, to have a vaccine before the election, runs counter to having a safe vaccine. And I think that's where my concern is. And nobody wants a vaccine more quickly or as I do. I really want to see one. And once there is a safe vaccine out there, I'm absolutely going to take it. I'm going to get my flu shot, by the way, this week. And I would encourage everybody else to do that too. Look, and every year I have this fight with people who won't get the flu shot, and it drives me absolutely crazy because none of the arguments there are fact-based responses to every single reason why people don't get the flu shot. You should get the flu shot, and this year it's going to be essential to get the flu shot, because if we see a spike in the fall in the COVID-19, which is likely because we're all going back indoors in a way that we haven't before, you can't have a bunch of flu cases in the hospitals at the same time. It's going to be a catastrophe for our healthcare system. So I'm probably speaking, I think I'm probably preaching to the choir with this particular audience, but yeah, I think everybody should get a flu shot. They should get it early. And that's one of the things we can all do to take a real substantive step towards trying to help this thing while we wait for a vaccine, which I hope is coming.
In a way, it's a double purpose. In a way, it's like a mask. I mean, I've had my flu shot. We used to think of flu shots as I'm protecting myself against the flu. Now, in the age of the coronavirus, we have to say I'm protecting other people so that I don't get the flu, so that I don't give it to 3 other people. I think that's quite important. Go ahead, Joe.
I was just going to say, one of the things that's really struck me about the mask thing, and you're absolutely right, it goes to the flu vaccine because it's the same arguments against. It misses the point that you do these things for other people. It's to make it safer for the community, not just for yourself. And I'm sort of disappointed to find out that Americans don't share that feeling in quite the universal way I thought they did.
One would have thought with all the charitable work that people would have seen this in those terms, but you're right, not.
I'd like to just make.
Here's another factor. There have been controversy over blood plasma. Go ahead.
Who, me?
Go ahead. Who was starting to talk?
Well, I just wanted to make one comment about the vaccine, and I think Joe is right about October is probably not realistic. I'm also worried that when a really safe vaccine does come out, maybe in January or February, that people will not want to take that, because we're not talking about anti-vaxxers. We're talking about just regular people who now don't know what to think. So I actually think it'll be a problem to have compliance with people taking a flu vaccine, a COVID-19 vaccine, when it actually comes out and when it actually is proven to be safe.
And
there's also a time factor. I mean, there's been controversy over blood plasma antibodies from recovered coronavirus victims, but maybe only useful or effective for 3 or 4 months. And if we're talking about a vaccine to be given at the extent that we say is important on a societal basis, is that something that's going to happen every 3 or 4 months? I mean, may we be facing something like the AIDS community faced, which is the necessity of a kind of a continuing treatment, injection or pills, that took, in the case of AIDS, the killer, and made it a chronic condition. It would not be inconceivable that this virus too, that we can't create a vaccine that's good for 1 year or 2 years or 3 years or life. We may be dealing, at least for a time, with a very short term that people might have to get used to. And again, the time factor is, yes, it's safe and effective. It's been tested for 6 months. What happens after 1 year? Or 2 years. So we may have to get used to a different concept of vaccination or of prevention. It seems to have worked in the AIDS community. Those cocktails seem to have proved very effective.
Yeah,
And it's something we may have to get used to.
yeah, David. There's two things, and they're sort of opposites. One is we know so little about the virus still, and that's something people I think have to realize, that the medical community is still trying to figure this virus out, and in most cases that takes a long time to research and test and learn about a virus. We still aren't real sure about a lot of real basic things about this virus. At the same time, it's sort of breathtaking how quickly the medical community has come up with effective treatments, and some of them simple things such as proning patients in the hospital, having them lie on their stomachs, and having that become an enormous benefit to helping the worst cases get through it. These are trial and error. These are things that have been discovered in such a brief period of time. It's just mind-boggling that it's only been, 6-7 months since this started, and we already do have much more effective treatments than we had when we started. So, this is a historic time, and we're all living through it right now, and most of us are living through it. Unfortunately, not all of us are living through it, and I think we do have. I think you're right. It's going to be moving forward. In some Asian countries who had outbreaks of different kinds, face masks in public became commonplace. Those countries have generally not seen the spread of the virus in the same way that Western countries have. And it may well be that masks in public become something that we're going to see more and more of here for the next couple of years. It may become a standard practice, just out of precautionary measure.
David, I think we should end pretty soon, but do you want to make any final? Oh, David may have left because.
Did we lose him?
I think we lost him again.
Afraid maybe that his internet failed, which did happen earlier. I think this is probably where we should end because we've billed these as relatively short programs. Joe, it was a real pleasure to have you as a guest today. You were wonderful to do that at a busy time for you. And David,
I'm back.
I think we're going to bring this to a close. I do want to mention, just in passing, that we've done some interviews with people from our local community that we have posted on the library's website. Joanna, how do they access those interviews if you're interested, including an interview with a gentleman who was hospitalized in the local hospital for 8 weeks. So if you're curious and have time on your hands sometime, check out our interviews. Joanna, they go to our website, and then what do they do?
You can go to our YouTube channel, which is Rogers MEMLIB, I believe. I'll post the link. And there is one playlist called Staying Connected, and that's where all of our recordings are.
All right, see, we make it hard for you.
I'm back. I'm sorry I got disconnected.
That's okay.
And I know you're going to wind it up. I want to say thank you to everybody. I apologize for my bad connection here. But I was very pleased with the conversation we had. Joe, you're a lifesaver, but thanks for all of you.
David, we didn't even get to talk about the impact on the Wi-Fi and internet infrastructure locally of all these people working from home out here.
I'm dying proof of it.
It's a problem.
Well, I'm sure that we all agree this was a wonderful conversation. David, you were a really terrific host and did so much work to prepare for this. And Joe, we couldn't have had a better guest than you. Thank you all for coming.